I know that a lot of my patients enjoy the sun, and many of them really like to have a nice deep tan during the summertime. But the truth of the matter is that the sun ages us. And so my job as a plastic surgeon and your anti-aging physician is to try to educate you about what you should and should not do. One of the things you should do is try to avoid the sun, and particularly during the summertime months, but probably all year long, you should try to wear an SPF of 30 or more on a daily basis. It really will go a long way to helping you to maintain your youthful skin. I'm showing here some photos of a woman who came to see me in her early 40s, and she had quite a bit of sun damage that she was unhappy with. She didn't really understand why it was that her skin was changing. In this case, she happens to have a condition known as melasma, but while this is hormonal related, it also is worsened and exacerbated by the sun. In taking care of her, I suggested a 5-day laser peel, which is pretty much exactly what as it's stated. I performed a laser procedure for her, which did make her peel, and 5 days later it was Christmas Day, and she went and spent the holiday with her family, and no one knew anything was done. They all just thought that she looked terrific. Here in my office we have several modalities of light-based therapy. Some of them are intense pulse light, which is called IPL commonly, and an IPL Photo Facial can be very beneficial and helps to get rid of a lot of sun damage without peeling at all. I also have non-ablative lasers, meaning that you will not peel, but you will get a little bit red and sort of ironically look like you have a sunburn for a day or so. The more dramatic improvements do happen with the more dramatic procedures. So as I mentioned, this woman had a 5-day peel. In more severe circumstances, I might perform a 7-day peel. What I use in my office is a fractionated ablative erbium laser, which does a very nice job of getting rid of fine lines and wrinkles, as well as getting rid of sun-damaged skin. If we look at her skin itself, you can see that she has a relatively dark patch of skin in this area, and again, 5 days later, although you can still see that she has a change in color, it is much more modest, and I think that she did very well there. When you look at the same patient from the front view, you can see that the sun damage and freckles that she had around the mid-face and over the bridge of her nose are largely improved, although not completely eliminated. And in addition, in her case, kind of a side benefit, the crow's feet that she had in the area by the corners of the eyes is nicely improved as well. Some of the nice advantages to procedures like this are that they're relatively simple to do. There's no anesthesia involved. You come into the office, it's very private. It only takes a few minutes to perform these procedures, and you leave the office feeling fine, maybe like a little bit of a sunburn, but that's about it. And if you take a look at the results in a woman like the one I'm showing you here, she no longer needs to apply what she called caking on the makeup in order to cover some of the sun damage that she was embarrassed by. It really makes her life a lot better, and she tells me it's one of the best things she's ever done.